Dental education overall is important. When you're getting implants, then there's a whole set of different instructions and a whole set of different care protocols that you have to follow in order for you to be able to keep those implants the rest of your life. Now, being an inventor of the system and being so familiar with every detail of this system, I can tell you confidently, there is no one that knows this system better than I do. The smart bone management system. I introduced this term back in 2010. So my implant, what it does is that it shaves the bone as it's going down, puts the shaved bone into those vertical flutes. The bone debris will fill in those gaps as it goes in. That's why I call it self-grafting. Traditional dentures work okay if they're made well for immediately after the extractions. But after a few years, the dentures will not have enough retention. That's when implants become handy, because implants can take the pressure off of the gums and put it on the implants, or can provide very good retention so that the teeth don't float away in the mouth. The dental science and the dental implants has grown tremendously. We don't practice anything that we learn in dental school if we graduated more than 25, 30 years ago. How does experience change? By welcoming the change and by not being afraid of the change. The type of materials that are used in dental implants are two at this moment. We have moved to type 23 titanium. There is a small group of dental implants that are making it with zirconia. Zirconia, in my experience, has no advantage over titanium. Titanium does not rust. Nobody is allergic to titanium. The titanium doesn't get rejected by the body. In the stage of planning, we plan where to place the implants and what size implants to use. We measure the face, we measure the smile, we determine these factors that the size and shape of the teeth should match that of the face of a patient. The maintenance required for dental implants, in a way, is easier than the teeth, because dental implants don't get cavities. The only maintenance is having the implants cleaned every 3 months. One of the important factors that sets our practice apart is that I'm able to put the patient in contact with someone else who has gotten the similar procedure lately, so that they can ask, oh, did he hurt? Did he do this? Did he do that? How did it go? So I'll put him in contact and they call, and invariably it goes very well. Another option my practice offers is intravenous sedation. There are people who have not been to dentists for a long time. They're usually very anxious. IV sedation is conscious sedation, but they don't care anymore. And it's a wonderful, wonderful tool. It happens often that we notice things that are needed that were not noticed in the beginning. And I tell the patient, don't worry. If you need a bone graft, that's part of it. It includes everything that is needed until they walk away with the final teeth in their mouth. What patients can expect when they come to our office is a friendly reception and a non-judging environment. We try to create an environment that is absolutely non-judgmental, so that they feel free to tell us what they have going on and what they don't like about it.